Many of you have told me that the new Marvel movies need a little medical fact-checking. Well, I'm ready to heed that call. Let's get started. Pee-woo!
Go, John. Wait, what? And leave you here?
Run! To Owens!
Uh-oh. Oh! Gems. Oh! Where did the water come from?
They're like water grenades.
Oh, water grenades. I'm trying to think what would be like a water grenade. It's like an IV solution bag that he's launching.
Okay, move now!
And didn't he throw like 4 little things? How did they create so much water? Oh, drowning's a problem. Big problem. You need the oxygen. You know what people sometimes don't realize is a lot of times during drowning, people think that their lungs are filled with fluid, but that's not always the case. Your respiratory pathway has a reaction to clamp itself off when there is water present. Sometimes some water gets in there, but if you're, let's say, resuscitated, revived on the beach or something, and a little bit of water went in there, maybe you cough it out, some of it can actually get systemically absorbed. So pretty interesting stuff. Can someone check a pulse and start chest compressions and call 911?
In 1 week's time, I will return with my entire army. And you will join us again.
Did they just defibrillate them? Did you even check the rhythm? Do you know the only 2 shockable rhythms are pulseless VTAC and VFib? Did you check? Plus they're on a wet surface. You're shocking everyone.
Keep it back!
Yeah, stay back. Don't go into the water while we're shocking people. Are they even turning up the joules the correct way? And because they found them drowning, they should at least give them 2 rescue breaths every 30 pumps. Oh, here we go. Turn onto the left side. Allow them to spit out the water.
Help me!
I see a lot of similarity between this and The Pit. Very realistic, very honest, lots of emotion. I mean, they did like a minute of chest compressions and they're calling it on their loved one. We do at least 1 round is 2 minutes. And then there's usually another person. And then we try and get epinephrine. You can't tap the beads and call for epinephrine? Angela Bassett, you're in 911. Help them on the script next time. Or get me in the writer's room. Although, I don't know if you want that. People in the writer's room are discussing the storyline, how important it's to the origins of Wakanda, and I'm just yelling, chest compressions!
You will never save the world. You couldn't even save a relationship with a goddamn stripper. And mother, I wish I could say you die alone, but it's one of God's best jokes that you can't die, except it's on all of us.
Maybe this is a coping mechanism for Wolverine where he's trying to express his anger, and perhaps it's not in the most mature of ways, but perhaps Deadpool will respond with some kind of empathetic approach.
I'm gonna fight you now.
Oh, are you?
Oh, wait, why is he bleeding? I thought he's superhuman and he heals ultra fast. Maybe his blood vessels inside of his nose are not immune to damage. Oh my God, intra-abdominal trauma. You're gonna have to do a full-on explorative lap on him in order to open him up and literally run the bowel to find what part of the bowel. I mean, he's just gonna heal ultra quickly, I know it. Oh, those are little. Those aren't gonna do any damage. Unless he goes for the orbits. Ooh, don't go for the orbits. He hit him in the carotid. He hit him in the carotid. His brain isn't gonna have circulation. You can develop a stroke from one carotid being sliced open like that. It's why when someone comes in with altered mental status and we try and rule out a stroke, part of our workup is doing an ultrasound of the carotids to make sure they're not fully obstructed. Oh my God, dislocation. The olecranon just said bye-bye. Okay, so this is interesting. What about asphyxiation? When he suffers extreme hypoxia, the trachea is deep enough and protected enough where you can still keep breathing. You could sometimes even keep talking, but from the pressure on those blood vessels, not get enough oxygen going to the brain because of blood flow. And then what happens? When you have hypoxia related necrosis essentially happening in the brain, can Wolverine heal that? The hamstring, that hurts. That hurts, that's painful. And I say hamstring because I feel like it went all the way through, not because it hit the quad. I know it hit the quad. Here's what doesn't make sense to me. I'm gonna go full doctor on this. The fact that there's so much damage and healing happening at the same time. What these Miracle Marvel fellas don't realize is that in order to have massive cell regeneration and division, you also raise the risk of having errors in that type of division. And when you have errors, you develop cancer. So unless these guys also have amazing tumor suppression, maybe they do. Maybe they can't get cancer either. Maybe they're immune to everything.
A few months ago, I went on a road trip with my cousin Bruce.
Yeah, it worked. I mean, my arm started to heal, and no one thought it was actually...
Yes, that Bruce.
It's all because, I made this little device which keeps me in human form.
So it's like a Xanax device, or like a biofeedback device, maybe, a meditation device.
What's up with this? Cheetos and chopsticks?
Yes, so you don't get Cheetos fingers.
I never thought about that. Cheeto fingers. I mean, you could just let them drop in your mouth or use a glove.
Captain America.
Oh! Ultra processed junk food.
Gets me mad.
The fact that they slid off and are continuing their momentum like that means the likelihood of severe injury is rare. Though that being said, their necks rolling around, twisting, concussion, all that can happen, but I don't think any of them will die. I suspect a broken radius, maybe ulna.
John, bleeding. Inhibitor. John, get away from me. I'm bleeding. Get away.
Oh. The Hulk is a communicable disease? Oh my God, it's a bloodborne illness. Hulk, immune, viciousness. That's what it was the whole time.
HIV?
The point was to prevent me from turning into a Hulk.
These transformations are triggered by distressed emotional states, so we need to know the exact threshold that causes it for you.
Right, so maybe we can work on some deep breathing exercises, biofeedback, meditation.
Bruce!
Oh, those are blades.
Feels like if I don't transform, I'm gonna die. You have a plan B for that?
Nope.
No? Not funny, Bruce. What, you're just gonna kill me? Come on! What if this doesn't...
Oh!
Use this chamber for you, psychopath!
Yes.
That's a scary test, because if that went wrong, that's murder. Oh. I'm pretty sure yelling no to someone who just turned into the Hulk the first time is the equivalent of me seeing a patient struggling with generalized anxiety disorder or major depressive disorder and just telling them to chill.
Oh, there it goes.
Oh, Spidey.
You okay? Oh, my back.
Oh, is it back? I feel like you're trying to open up your sternum there and perhaps create a little crack. Some people develop costochondritis, where the ribs meet the sternum, the breastbone, and where they move, they can develop some inflammation, especially if they start doing some new kind of exercise plan. And what people don't understand is that in between the ribs, there's tissues, there's intercostal muscles, which are literally muscles in between the ribs that help you breathe, and then also nerves that penetrate those muscles and then give sensation to a region. So sometimes people get like this regional pain in this area or in this area, and where it can come from as one of the potential causes, especially if all the more serious stuff is ruled out, is from that nerve being entrapped. And one of the diagnostic ways that we look into that is by actually numbing that nerve, performing a nerve block and seeing if the symptoms resolve.
You want me to crack it?
Yeah.
Yeah?
Yeah, that'd be great.
All right.
Oh.
You ready?
Yeah.
That's good.
You know, the cracking actually doesn't do much.
You tried to fix me.
Miko.
Now, I'm gonna fix you.
That's what I say to my patients sometimes. I'm gonna fix you.
You can thank me later.
Kick it! Kick it! Oh! The Green Goblin stays having explosive grenades.
May, I'm here.
How did she survive? Maybe he has a rib fracture. I can't tell where he's holding pain. My God, he's holding kind of right lower quadrant abdominal pain. I hope he's not having appendicitis.
Yeah, I think I broke my ribs.
Aha! The diagnosis was made, Spidey. The annoying thing about breaking your ribs is that if they're not displaced significantly, a lot of times there's not much we do because they just stay in place, they heal, but they're very painful and takes weeks to start feeling improvements there. And one of the things I do with my patients is I make sure I give them an incentive spirometer, which is a device that encourages them to continue to breathe deeply. Because what people do who experience pain when they breathe deeply, like those who've broken their ribs, they splint breathe, which means that they take like these really shallow, small breaths and they can function that way, but then they develop atelectasis at the bases of their lungs, therefore leading to worse lung function, potentially compromise of the airway. So we want people to breathe deeply.
You have a gift. You have power. And with great power, there must also come great responsibility.
I feel like I heard that before. Is that part of the Hippocratic Oath?
Let's get out of here. Okay, let's go. Just catch her.
Oh, I feel like she has a concussion, and now this is potentially signs of a brain bleed. We need to get her a head CT stat. Because remember, mechanism of injury is one of the most important factors in deciding if someone needs a head CT. And if she came into my office and said, hey, the Green Goblin just threw a giant grenade at me, do you think I need a head CT? The answer is yes.
Yeah, you're okay. What happened?
A grenade just exploded and parts of the building landed on her body. But luckily, you caught her falling from 3 feet high.
Catch my breath. Okay, well, catch your breath. I'm right here.
You have to check for signs of intracranial bleeding. You need to do a full neuro exam, Spidey Man, and see if you need to get her to a hospital stat. Because if she has internal bleeding, you need a craniotomy. You need to get her help stat. Where's she bleeding from? Source! Find the source! Put pressure!
Somebody help, I need an ambulance, please.
Bro, you have Spidey things! Shoot them! Fly somewhere!
Nothing happening. You're okay, you're okay.
Bro, turn it, something. If Spider-Man ever found me and I'm bleeding out and a piece of a building just fell on me and he asks me if I'm okay, first of all, I'm gonna slap him. Second, I would ask him, please rescue me and shoot your Spidey web into my wound.
Wow.
This guy's in everything.
Why the aggression, huh? Is it your time of the month?
I don't get my period dip. I don't have a uterus.
Or ovaries.
Yeah, that's what happens when the Red Room gives you an involuntary hysterectomy.
A hysterectomy and a salpingo-oophorectomy. Because it sounds like she has no ovaries, fallopian tube, or uterus.
They kind of just go in and they rip out all of your reproductive organs. They just get right in there and they chop them all away. Everything out.
Okay, I'm sure they're not chopping them up like it's a salad at a salad bar, but in the early 1900s, and I'm sure this has happened in other stages of life, but this is what I'm aware of. Literally, states in the United States, I know North Carolina is an example, they had a eugenics board, which if it deemed you genetically unfit, they could sterilize you. A lot of times it wasn't through a hysterectomy, perhaps it was a different procedure, but still, these were forced sterilizations and they did happen. Even at one point, there was a big case where they nicknamed hysterectomies as the Mississippi appendectomy. How sick is that?
Come on, Reed, what are we doing? Sue, we need 30 seconds of invisibility. Can you do it? After your next contraction.
She's giving birth? Birth on a spaceship.
We need to strap you down.
Strapping her down.
Do not strap me down!
Not strapping her down.
Baby, You need gravity to push.
Do you need gravity to push? I mean, I'm sure you can deliver babies in all sorts of ways, and I've seen unique things, but most people are laying down. So, I mean, maybe a little bit of gravity.
He's coming. He's coming.
Give me your hand.
They don't even have a fetal heart monitor on. How do they know if there's compromise? I mean, there's issues with that too. By the way, there's like a lot of issues with fetal heart monitoring and how it's increasing rates of C-sections, sometimes unnecessarily, because of the fear of loss. All right, I'm gonna get over it, but here's the headline.
Push. Yes, you can. 0.85. Thrusters engaged.
This guy looks like he needs some bioderma because his skin is just absolutely calloused over. Like some intensive balm would just go a long way. I'd probably recommend using shower oil instead of soap. It's probably illegal to be in space when you're like after 36 weeks because it's the same rules as when you're flying in an airplane cross country. Like there are limitations to when you can board an international flight. So depending on which galaxy, they may have different baby benefits. You gotta think about that.
I got you, little guy.
Get the baby on the mom's chest. That is the most important first step. After checking the APGAR scores, of course. Oh, stretchy man. We're back. By the way, you know when you stretch, you're not really stretching your muscles. I mean, muscles have a little bit of give, but you're stretching connective tissue, ligaments, tendons. And part of when you feel tight and you stretch and it hurts, when you develop improvements in the first few days of doing stretching, a lot of it is just tolerance of allowing your brain to lower its neurologic response to say, oh, I can go this far, it's not so bad. Oh my God, does Mr. Fantastic have Ehlers-Danlos? Someone needs to make sure his heart is okay because there are cardiac complications that can come as a result of that. Oh no. So you can't do that to a human. Skin is elastic and it bounces back when it's hydrated, but it's within physiologic limits, you know what I'm saying? You know, actually one of the tests that we do to check for dehydration is skin turgor, but you will see in older people, it does take longer for it to bounce back because it's not as elastic. But it's definitely not as elastic as that. Oh. Oh. Ah, and the baby's still around.
Yeah. Two.
Someone check a pulse before I start yelling again.
No. Sue.
Pulse, not breath. Pulse.
Is she breathing?
No.
He didn't even check a pulse. I mean, fine, look, he's not a first responder, he doesn't know, but no one's called for help thus far. Did they also have like one of these little watch things?
You stay with us, okay?
And of course they're doing terrible tests. And don't you dare in the comment section come in here and say that, oh, well, they don't want to hurt the actor or actress, so they're not going to do deep 2-inch chest compressions. They're shooting them out of space and being stretched left and right. They can push 2 inches on the chest to show proper chest compressions. Oh my God, it's so bad. Did he even do 30? I don't even know. 2 inches deep. Full weight of the body. If you crack a rib, all good, but allow full recoil so that the heart keeps pumping. And she collapsed right in front of him. You don't need to do rescue breaths here. The reason being is she still had some residual oxygen in that circulating blood, so it's your job to circulate it.
Come on, Sue, stay with us. Don't leave us. Sue! Come on, baby.
Bro, you're not helping her. What is the baby gonna do? Baby doesn't know chest compressions yet. Oh, come on. Marvel, writers. Do you know what you're doing by writing the script this way? The next time someone sees a mother collapse on the street, instead of performing proper chest compressions, they're gonna knock on the chest or whatever the heck he was doing, and then throw a baby on it in hopes it helps. Oh. Yeah, her newborn baby learned how to clap. That's real. See, you know what I believe actually happened in this scene? Because he didn't check for a pulse, she never was fully out. She was probably breathing, had a pulse the whole time, put the baby on it, and it created all this drama for no reason. Marvel isn't the only one with medical scenes. Anime injuries. Click here to check those out. And as always, stay happy and healthy.